My name is Ed Evans, and I'm a family physician in Seneca, South Carolina. I grew up in Atlanta, Georgia, and went to college at Mercer University in Macon, Georgia, followed by medical school at Emory in Atlanta. Decided to do family medicine, and I went to the University of Virginia for 3 years to do my family medicine residency, and came back and originally practiced in a little town called Jasper, Georgia, for 8 years before moving to South Carolina. I chose family medicine because my parents were both from small towns in Georgia, and I enjoyed my time up there so much. And when I decided to do medicine, I thought family medicine would be the best lifestyle in a rural area. So I've always enjoyed living in the smaller areas, and family medicine made the most sense for that. I've really enjoyed the breadth of practice in family medicine. I continue to do obstetrics as part of my practice, which is probably my favorite thing in medicine. And the breadth of seeing a baby and a prenatal patient and a geriatric patient one after the other, and having that variety all day keeps it fresh and very enjoyable. I often describe myself as a teacher, having recently been running the residency program, and I translate that into teaching patients as well. So educating people about their health is something that I'm passionate about. I enjoy pediatric practice, sports medicine, and something called wilderness medicine, which I jokingly tell my wife is a way that I can go camping and call it work. But I enjoy that sort of thing very much as well. I like to think that I'm a good listener, that my style of practice is to really find out why someone is in my office that day and address that need, trying to avoid the temptation to check all the boxes that today's computers want us to check in order to complete a visit, and use the time that's left over to do those things, but really to get the patient's main concerns addressed every visit is a goal. I chose to come to Prisma Health because I'd already been living in the upstate as a physician working for another organization. I really enjoy where I live. All my children still live in the area, and the hospital where I've been practicing is where I want to continue doing my inpatient work there at Oconee Memorial, so it was a perfect fit. Outside of healthcare, I'm very active in my church. I'm a deacon at the church, and I play piano there and teach Sunday school, so I'm very interested in that. The outdoors, particularly hiking and backpacking, the upstate is a great place to live for that. I'm an amateur astronomer, so I have a telescope, and it's getting harder and harder to find dark skies, but I enjoy doing that well. And I've also just started taking horseback riding lessons. I've had 3 lessons, so I'm looking forward to learning more about that. 3 questions that I think patients should ask but usually don't are, what are the alternatives to the traditional things that we do in medicine that we might explore? Many people come prepared with questions about that because they've been on Google, but alternatives to medications and surgery are important things that I think people should ask about. I think people should ask questions about the hospital where they're being treated, and about the safety measures that are in place for themselves and their family when they come to visit. I guess a third thing that I think that people should ask more about that they don't is about their end-of-life issues. That is something that I try to remember to bring up before it's a critical time, but having people prepared with the discussions with their families in addition to the documents that we tend to need is something that a lot of people neglect. So I try to be sure to bring that up during calm times. If you'd like to make an appointment to see me, you can find the webpage for Seneca Medical Associates in Seneca and arrange an appointment there.